Dr. Chandrani, obstetrician and gynecologist in Neotia, Bhagirathi Women and Child Care Center, Newtown. I would like to highlight few important points about the importance of cervical cancer screening. This cervical cancer means cancer in the neck of the womb. So why the screening is so important? Cervical cancer is one of the most common gynecological cancers all over the world. And this cancer is a slow growing cancer. That means it progresses through a precancerous phase, which is very easily detectable through screening, and we can completely cure it if we detect it at the precancerous stage. So the screening is important for all women irrespective of their risk status. So there are various methods of screening. The common ones are pap smear, which could be conventional pap smear or liquid-based cytology. Another one is HPV DNA testing. Why this is important? Because cervical cancer is caused by human papilloma virus, and 90% of this virus are usually HPV type 16 or 18. So we can pick up those by HPV DNA testing. And the third one, which is mostly popular in the low resource setting like in village setting, in poorest settings, is VIA. That means visual inspection under acetic acid. We see the cervix, apply some acetic acid so that the abnormal area there stains aceto-white, and we pick up those cases. In all of these cases, this is an outpatient procedure. That means the woman will come to the outdoor, they will lie in the examination couch. I won't say the examination is painful, but it may be a little uncomfortable. We will introduce a speculum inside, we look at the cervix, and then we take the sample. In our country, pap smear is the most popular one. So the idea is, if we pick up those women before the frank cancer develops, we can completely treat them and we can prevent the formation of cervical cancer. So this is the idea behind screening, and that's why we gynecologists emphasize so much upon the cervical cancer screening. Now, how frequently should we screen? There are different consensus upon this. The American colleges, they suggest to start the screening at 21 years of age, and they screen every 3 yearly till 65 years. But they also suggest if we do co-testing, that means the pap smear and the viral DNA testing, then up from 30 to 65 years, we can also increase the interval in 5 years. That means 21 to 30 years every 3 yearly pap smear, and 50 to 65 years 5 yearly co-testing. But according to the UK colleges, they start screening at 25. They do 3 yearly till 50 years and then 5 yearly till 65. So what we do after the screening? When we take the sample, we send it to the laboratory where the pathologist tests whether there are any abnormal cells, abnormal changes are there. Depending on the level of abnormality, we decide the further course of action. We may advise them further screening at a 6-month or 1 yearly interval. We may recommend them to have another testing, like if they are having pap smear, we can advise them to have a DNA testing, or if they are having a DNA testing, we can advise them to have a pap smear. Or we can also advise them to undergo biopsy. This biopsy also is colposcopy guided. That means we will see through a scope, which is a magnified scope, they identify the abnormal area and then take a biopsy to confirm the diagnosis. So I will request all women all over the world, irrespective of their risk status, to undergo this screening. So the take home message is, be screened, stay healthy. Thank you.